Aging Well Senior Health Advisories deliver important information to educate and support seniors about the importance of preventive health, making and keeping doctor appointments, prescription medicines, and good nutrition to prevent obesity and reduce risk of disease. Aging Well with Medicines.
What I found helpful for some people is to write a list of their concerns and questions. I think the other thing that's important is to bring in, if you don't have a list that you carry with you, bring in a list of your medications or all your medications, including anything you buy at the health store or over-the-counter medications, because sometimes they can interact with prescription medications. So being prepared, have a list of your concerns and all your medications, prescribed or not, brought in with you.
I talked to my regular physician, and also I have a wonderful pharmacist that if he sees that I'm being prescribed something that he thinks will interfere with this Coumadin, a lot of medicines don't agree with it, he'll call me and say, I think you better check and see if that'll really be okay with what you're taking.
There is a growing use of generic drugs versus branded prescription drugs. Generics are cheaper, but are they as effective as branded drugs?
Generic drugs, for the most part, are just as effective as the branded prescriptions. Most of the research that is done on certain diseases and specific treatments is done with a generic version of a drug. So when a doctor follows the strict guidelines of diagnosis and treatment, usually a generic drug is just as effective.
Even taking generic drugs, many patients have difficulty paying for their prescriptions. What should they do?
The nice thing about generics, of course, is that they're inexpensive. Insurance companies tend to preferentially pay for those since it costs them less out of pocket. But they're usually very, very good medications. They're just fine.
Well, we usually have multiple medications for one condition. So what we usually do is take into account other medications that the patient is on, look at the patient's lifestyle, look at the patient's other medical problems, and then we select from that group of medications what would be best for that patient.
In general, there is very little difference. I mean, the FDA has very strict guidelines of what the generic drugs have to meet to qualify to be a qualified generic drug. Then on the flip side of that, though, I do have people say that they feel better when they have that trade name drug. But in general, usually generics are equivalent, and they do save a lot of money.
Sometimes patients suffer side effects from medications. They should not suffer in silence, nor should they stop taking their prescription drugs. What they should do is contact their primary care physician.
In terms of the side effects, I hope that your physician has warned you about those. If you should develop side effects, let your physician know. Too often, I have a patient come back to me 2 months later and say, yeah, I developed this symptom a week into it, and so I quit it. And we're 2 months down the road, and they've had this medical problem that's gone untreated. So it's important to communicate with the physician, let he or she know what kind of symptoms you're having, so that an alternative can be found or some different sort of approach can be done.
Well, first of all, a patient should never discontinue a medication without first talking to their doctor. We try to teach patients that that's really not very safe. But if we find out that a patient has an ill side effect or has a concern about a medication, it's as simple as giving us a call or coming in for the appointment so we can discuss other options.
It's very important that when you're suffering from side effects of medication to contact your doctor's office right away. Oftentimes the nurses and the physicians are able to look over your medical records and see which medicines are causing problem for you and provide alternative to you.
A patient should always call their doctor and the doctor may be able to deal with it over the phone. Or if the doctor is real concerned, the doctor would have the patient come into the clinic and address those concerns up front. A patient should never suffer in silence. Doctors are always available.
One major recommendation is to get a flu shot annually. The flu is harder on older people, especially those with chronic conditions such as diabetes.
I try and get all my elderly patients to get flu vaccinations. Simply because as you get older, your risk when you develop influenza or any serious illness is much higher. So the mortality in the very old or the very young is fairly high with influenza, and to prevent that, an influenza vaccine is really important.
Well, actually, influenza kills a lot of people, probably several thousand people each year, and the flu vaccine can prevent a lot of those, especially for people who are older. And that's just one of the things that we recommend on an annual basis. There's also other vaccines that can prevent infectious diseases like tetanus, pertussis, pneumonia, and shingles.
The Aging Well Senior Health Advisory is produced by Seattle Community College's television in cooperation with Public Health, Seattle and King County, Snohomish Health District, Essence Healthcare and its participating hospitals and medical centers in Washington, the Polyclinic and the Everett Clinic.